Welcome to another episode of the podcast. Today, I am joined with Dr. Jane, and we are talking all about fertility and how we can support our bodies to have second and third babies as well. But before we dive into that, could you please let us know one thing that you did today to take care of you?
I do lots of things to start off the day. Red light therapy is probably one of my favorite things, and that's what I do almost every morning. Sometimes I'll do it on my belly, sometimes I'll do it on my liver. Today I did a bit on my liver, a little bit on my belly, and a little bit on my face.
With this darker weather at the moment, I just plugged mine in this morning too because I've
Yeah.
been forgetting about it and noticing that I need it.
Yeah, it's huge. The happy lamp in the winter time, I think, is probably the most underestimated thing. It's just like that's how I wake up with a happy lamp, and then I'll start doing some of my other stuff. And it works. Like it really does work. We have science to prove it.
Mhm. So, can you share a little bit about yourself and what it is that you do?
For sure. So I'm Dr. Jane Levesque. I'm a naturopathic doctor, natural fertility expert, and I help couples who've been struggling with infertility to conceive and bring healthy babies home. I've been a naturopathic doctor since 2015, and then I specialized in fertility in 2020. So I'm going on my fifth year in the space of infertility. And of course, my own personal journey kind of brought me to the space. And the passion is to really help set a new standard for natural fertility care and what that looks like. And genuinely, I believe like natural medicine is the medicine. Don't get me wrong, we need conventional medicine and there's a time and place for it. But we have kind of been relying on it way too strongly and without any understanding of the root cause of the symptoms. And when it comes to fertility, if I believe it's a natural process, when it's not happening, I'm thinking, why? Why is the body not doing the thing that it's designed to do? And so I really love digging for that root cause and figuring out and help to support the imbalances and really build generational health. I think we put so much time and effort into saving up for a house and making sure we have the right career path as women or, even for men. Financially, we're secure. We have the house, we have the freedom, and we traveled. And then it's like, okay, let's just have kids and see what happens. Where in reality, everything that you're doing before you conceive is actually setting the genetic code for your child. And then what you do during pregnancy and postpartum is very, very big. And that's what I'm passionate about because I have two girls and I was very different during the two pregnancies. And I can see the difference in their health, in their nervous system function, and their ability to handle and regulate emotions, just like who they are. And I think it's really powerful. It's really powerful to be able to prepare for a pregnancy and know what you're doing and feel like you're going in with control versus just like, I guess it's the way that my body is, which I just don't think is very empowering.
How long do you recommend that people prepare for pregnancy?
Yeah. I mean, I'd love to see people prepare for a year. Minimum, it should be 3 months. But if you look at the egg and how much it takes for it to mature, so if you do an antral follicle count, which is something that you do an ultrasound before day between 6 to 11, to see how many follicles you have left, how many follicles you have maturing. Those are the follicles that have been maturing for 5 or 6 months. We're not seeing the ones that haven't been maturing. And so it's a bad sign if you don't have any that are maturing and you can be, diagnosed with premature ovarian failure. If that's the case for you, of course, there's other markers that need to be in place. But those follicles have been maturing for 5 to 6 months. And for the sperm, it's minimum three, like it's 3 months men are making new sperm. So depending on the reason of why they're not making good sperm, we can have really tremendous impacts on 3 months. But sometimes obviously it's longer if it's connected more to the brain or to an environmental toxin that's really deep. So 3 months is like the bare minimum. A year is ideal because we can have really big impact. But what I really want is for people to think about health and fertility are one of the same. So if you're improving someone's health, you're improving their fertility. If you're improving their fertility, you're improving their health. Yes, there are some really big nuances in the fertility world that are important to know that will help the body, get pregnant and stay pregnant and have a healthy pregnancy. But as a woman, you should be thinking about treating your bodies like if you want to have children, not just what you do the 3 months before, but like, how have you treated your body throughout your entire life? What are the traumas that you've carried? What are the toxins that you have accumulated? There's so many aspects to that where we just expect it's just like buying a house. Nobody buys a house in 3 months. It's something that you start thinking about putting away and mortgages and blah. Like you think about that for sometimes people do it for a decade, right? Depending obviously on the cost of the houses now. I would love that to be the case for our children as well, is that we actually raise our kids to start thinking about their health, their reproductive health in a way that then fosters optimal fertility so that we can continue to pass on the good genes as opposed to the bad ones.
Yeah, that makes a lot of sense. And I wonder with infertility being on the rise, if the next generation will be forced to look at that, that it won't just be a
I
nice to
think we
have.
already are. I think we already are there. And they're predicting the fertility rates to continue to drop by, I saw a stat somewhere, and I know it's hard to predict those things, but they were like 1 in 2 couples will struggle by 2050. It's like, that's not that far away. And really what that tells me is the kids that are being born today, the health of those children, it is compromised. And I always challenge my patients to set a higher standard of health for themselves. Because if I look at the conventional system and kind of health and disease as a spectrum, the conventional system, you'll be right on the end of the disease. Like you just need one more marker and you're, oh, sorry, you got cancer. Oh, sorry, you have diabetes. Now you need medication. They'll just be like, no, you're normal. But in reality, if you go to the other side of the spectrum, you're going to feel so much better. You're going to have more energy. You're going to have, you're going to be at an optimal weight. You're going to have muscle mass. You're not going to have crazy PMS and acne and hair loss and all of this other stuff that comes with disease development. But disease doesn't develop overnight. And so we are very much, I always zoom out and I see the women and the couples that are sitting in front of me today. I'm asking them what their childhood was like. I'm asking them what the pregnancy of the mom was like. And even sometimes you have to go as far back as the grandmother. Most people have no idea because we just don't talk about it. But the grandma, when she's pregnant with your mom, that's you. You're in there. You're the oocyte that's being developed. So it's very much generational. And the fact that it's on the rise, it's like, what did we do 50 years ago? What did we do 100 years ago that we are here today? And then how do we fix that?
So, what are some of the main causes of infertility? It sounds like there are a lot of different root causes,
For
and we
sure.
could go back generationally, but what are some of the main ones that you notice?
Yeah. I mean, people are very inflamed. And I think the inflammation is coming from stress, where we are having babies a lot later in life. We are relying more on the conventional system. So women weren't on birth control for 10, 15, 20 years at a time, where you basically are blocking, the brain and the ovaries from communicating and then depleting a bunch of your nutrients, changing your microbiome. There's a lot of toxins. There's a lot of toxins that like they're literally falling from the sky. And I hate to be this person because every time I watch modules or research on it, it's like it's depressing, it's depressing how much we're surrounded by. But I also see the silver lining that, hey, we can make a change, and here's how we make a change. How did we get here? And, being a conscious consumer and all that jazz. And so, you add all of those components together where the diet is atrocious because you're eating processed food. You have no idea where your food is coming from. You're not eating enough protein. You're working much longer hours than you ever probably did before. And they're more sedentary, meaning you're sitting most of the day staring into a screen instead of being outside. So then you're not really moving your body. And then your sleep is disrupted because you haven't really moved your body and you're hyped up on caffeine or processed sugar or whatever. And then you have the extra weight that's causing the inflammation. And then the gut is, the microbiome is essentially, like it's just rubbish, as my mentor says, because you haven't fed it any nutrients. You have no idea how to feed it. It's all processed foods. You're not sitting down and eating and having meal times. You're eating in front of a screen or on the go. And so for everybody, it's going to, for like an individual couple, you're maybe not going to hit all of this, but you're going to hit 3 or 4. You're going to be like, yep, that makes sense. And this makes sense. And this makes sense. I see a lot of couples who have struggled, like if the mom smoked during pregnancy or if there was smoke, like smoking in the house, or maybe you lived next to an industrial area, or there was alcohol or whatever. All of those things tend to add up. And, by the time you're 35, ready to have a baby versus 25, your ubiquinol levels are down, your mitochondria is not functioning as well. You're already starting in the aging process instead of being this prime peak. And so then it just makes it more difficult. It's not impossible. Most of my clients are over 35, but you just have to be a lot more mindful in terms of, oh, I've been on this planet for 35 years and I've accumulated this much, and my body is at this stage versus I'm 25 and, it's 10 years less, essentially, whether it's a disease that's been progressing, or a toxin that's been accumulating, whatever it is. But yeah, I would say those are the big hitters.
That it's a lot of things, isn't it? And I
Yeah, it's not just
imagine,
one. It's never just one. People always are like, what's the one reason I can't get pregnant? And it's like, I don't know. When I see the testing, I'll tell you what my suspicion is. And when I get to know you as a person, I'll tell you what you're holding on to and where the energy is getting blocked. And then we could see it, but it's not like one thing. It could, just like it's not going to be one thing that gets you out of the situation.
yeah, and there'd be very few people that only one of those things would be impacting them. Like when you're going over that list, to me, that was describing our entire population.
Yes, for sure. Yeah. Yeah, but there's a lot more people who are aware of that now, and they are trying to focus on getting better sleep, and we are trying to source better food. And I think for the most part, there's a lot of people who still don't think that's important. Um, and the only thing you can do is lead by example. If my daughter is coming into class and she doesn't have any allergies, and she doesn't miss any school because she's not really ever sick, and when she is, she just kind of bounces back and she can focus, and the teachers like her, and then people are like, oh, you're so lucky. And it's like, actually, I'm not lucky at all. I'll show you what I do. You can do it too. Let me show you. And so then it's like, oh, I can I can do this, and I can, right? And this is where I don't mean to harp on the conventional system, but if you go to the doctor every time and you feel like something is wrong and you go for help, but they go, no, that's normal. Now there's nothing you can do about it. Now that's just the way that you are. You just kind of start believing that. And so if you're a kid who has asthma and you were just told that's the way that you are, when you are 25 or when you're 35, you can't conceive, and they tell you that's just the way that you are, you go, okay, I believe that. And so that's what I'm seeing when I'm, chatting to my people. It's like they just believe that's the way that they are because they've been told that since they were little. And so part of me going on podcasts like this is to help shift the belief that your body is capable of doing incredible things, and it can heal. Just like when you cut your hand, it doesn't just bleed out. You have mechanisms that help to seal that up. You have those mechanisms over your entire body, and there's priorities. You can live without a uterus. You can't live without a heart. You can't live without a liver. You can't live without your gut. Sure, maybe sections of it cut out, but it's not going to be great. So the body has a list of priorities that, it needs, but it can heal. And it's not just the way that you are. There's something there that's causing it. And whether it's physical, energetical, depending on your belief system, we can get to the root of that.
What are some of the things that you suggest people doing? Like you mentioned a few of them there with sleep and our environment and food. Is there a baseline that you start people on with, okay, you have
Sure.
to start prioritizing XYZ no matter who comes into your office?
Yeah. I think that there's general advice that you could just get on the internet. And by the time you get to a practitioner, you should be getting specific advice. That's kind of when I'm going to a practitioner, I'm not looking for general advice. And because you can get it on the internet, it's everywhere. Most people know they need to sleep 7.5 to 8.5 hours of sleep. Most people know they need to eat more vegetables. Most people know they need to move their bodies. And so those are kind of the pillars: the sleep, the digestion and nutrition, the movement, hydration, and stress management. Those are, and you can go really deep into each of them, but there's general things that most people understand. I think as a practitioner, and if you've already done the general stuff and it doesn't work, it's not that, or you haven't gotten to your goals, it's not that those things didn't work. It's that you actually need to go more deeper now into a certain section. So this is where the testing comes into play. And I do a lot of data collection. So I'll do a lot of testing, like look at the gut, look at the urine, look at the environmental toxic load, look at the blood, the nutrient levels, all the, amino, like you name it, liver function, kidney function. I do a lot of testing, obviously. My couples have been through a lot. So it's like we just need to get to the answers. And then I'll collect data. Like I get them to write down, what are you eating every day for 5 days? How are you sleeping? If they have a device like an Oura Ring or Garmin, they're plugging that into my system so I can see it. And then I can give them specific. I'll have people who are like, I thought I was sleeping better. It's like, yep, turns out you're not, and it's like data doesn't lie. So then I can really help focus. Like I know sleep is the most important. But if you have a lot of parasites, if you have a lot of inflammation, if you like your system is just not going to let you rest. And so sometimes it's like, yep, do the sleep routine, but we actually need to focus on digestion because until we get this microbiome shifting and moving and getting the parasites out or whatever infection it is in there, you're you're not going to sleep well. And that's okay. We can use some aids and we can, help you get in there, but to get to the root is actually this. And so I very much do everything based on data because everybody's so different, not just based on the results, but like what they're capable of and what they know and their implementation strategies and how much they can implement at a time. And I think to set yourself up for success, it's not just grasping at straws, hoping like, oh, I'll try this. It's okay to go through that phase. We've all been there. But if you've done that and then you're still not getting anywhere, to me, it's like, well, you actually just need a coach. Like you need someone to help you because you don't know, you no longer know what you're doing. And that's okay because I have coaches. Do you know what I mean? Like I don't know anybody who's really successful who just made it on their own and said, I didn't need any help. It was all me. I think there's faster ways to do it.
Yeah,
Like someone
better
who's
ways.
already done it and can tell you exactly the mistakes that they made and help you walk you through, you know, so you can get there faster.
And what about secondary infertility? How is this different from people who are struggling with having their first baby? Is it different or is it not?
Yep. Um, I think that every pregnancy is just different. I think the expectation is, and this was for us as well, like the expectation is when it happens the first time that it's just going to happen again and again and again. And in reality, a pregnancy is the biggest hormonal change that the woman will go through. It's the hardest thing that she will ever do. There's a lot of depletion of nutrients. Like if the woman starts at 100, she depletes about 50% of her nutrients through the pregnancy, and then another 25% from breastfeeding for a year. So she's left with like a quarter. And so a lot of the times, if you're not repleting or if the pregnancy barely happened the first time, like there's so many or whatever. So in secondary infertility, I think emotionally it's harder. I don't know if that's true. I think it's like, do you know what I mean? It's all hard, but it's harder because the expectation is that I can do it again. And in reality, every pregnancy is different. And just because you had one, the second one is not a given, or a third one is not a given. I do genuinely think it is a miracle every time. And the more that I study pregnancy and everything that has to happen, I'm like, I'm amazed we're all here. I'm amazed we're all here. How does it happen? Because there's a lot of details. So I think the reasons are the same, but it just might be in terms of like when I approach secondary infertility, I'm still doing the same thing. I'm still testing and I have no idea why the first one happened and how it would, but we talk a lot about the details. And for some women, it just happened and they're like, I have no idea. Like now that I'm here, I have no idea how I got pregnant the first time. Because there are those miracles. There are those angels that just come and visit, and you get to keep them and it's amazing. But I'd like to obviously take a bit more control and see if we can, hey, if these blood sugar is dysregulated, you're more likely to have a miscarriage. If this nutrient is low, you're more likely to. And so I kind of blend the science with the managing the emotions to help us understand why. But I just think every pregnancy is completely different. And so you have to approach it as that.
Yeah. And is there, like, are they similar in likelihood or is secondary infertility more common?
No, I don't think so. I mean, to be honest, I don't know the stats of that. But no, I just think infertility is to get pregnant. Like even if you're really healthy, it will take 3 to 4 months. So people expect to kind of get pregnant on the first try. That sometimes, yeah, that happens. Absolutely. Typically, you want to give the body at least 3 to 4 months because even if all the stars are aligned, you're not ovulating the best egg every time, right? And or the sperm, whatever, doesn't get through. There's something that blocks it just doesn't happen. And so my wish is that we would get help right away, like before we even start trying to conceive. But really, if it's not happening within 3 to 4 months, I would say that it's room for investigation. It's hard with secondary infertility if the babies are young. Like sometimes I find that the moms are trying to conceive while they're still breastfeeding, while the babies don't have schedules. So it's like they're actually just really depleted, and the body is like, I don't have anything to give. I'm still running the marathon, and now you want me to start a new one. So sometimes it's unrealistic expectations versus actual infertility. In terms of statistics, it's like, to me, it just comes down to the education. You know, hey, is it actually infertility or is it we just need to replenish some nutrients? Um, and yeah, I think they just group it together as a stat.
Yeah, and I wonder with secondary infertility, a lot of the time now people seem to be having kids older as a generalization and having
Totally.
them closer together. So in previous generations or like our ancestors tended to have kids at least 3 years apart, but now people are having them 1 or 2 years apart. So our bodies maybe just aren't designed that way. So it is
Yeah, you could
harder.
do 2 years apart as the closest I think you could do it, but you have to do it. To me, it's like you have to be very intentional if that's what you want to do. And my preference is to be 3 years, though when we're looking at 2 years apart, usually there's some family planning or the age is a factor. And it's like, hey, if you're 35 now, having a baby at 37 will be better than at 38 or having a baby but you should be very, very intentional with, like I said, the whole depletion. It's like you are depleted during pregnancy. It is a very depleting, it's a vulnerable state, it's an inflammatory state. And so if you're inflamed for a year and then you go through this um, and deplete it for a year, and then you go through this big event, even if you have the most beautiful birth ever, it is still a huge event on the body, right? Usually you're not sleeping for at least 24 hours. So for some women, it's 48 to 72 hours. Then it's maybe there's complications that are involved. You're making big, like it's a huge event. And then it's not like you go to this retreat and go to sleep for a month. Do you know, like now your milk is producing, you have night sweats because the hormones are fluctuating, you have this baby that needs you constantly, you're anxious because you want to make sure. So we have to take all of that into account. And like that's a year. Ideally, you're going to breastfeed your baby for a year, maybe a little bit longer, but generally we don't need to do it for more than a year. You're still in a depleted state. And so if you start a pregnancy now, while you're still, and you didn't replenish anything, you just continue to eat your regular foods and blah, and you have no idea if you were actually missing anything, it's just hard to ask the body to do that again. Again, I compare it to a marathon. You just ran a marathon and then you went and did an ultra marathon, and then you're like, yeah, I'll just start another marathon, no problem. A lot of the times you're like, that doesn't make sense. I should probably recover a little bit. But most people think they need like a month to recover versus they need like 3 to 6 months to recover, you know? And so that timeline is not as long as people think, but it's a little bit longer. Most women are like, after a month, like I've been taking a prenatal for a month. And I say this because I was one of those women. I'm like, I took a prenatal for a month and then I got pregnant. It, the way that pregnancy was versus my other one is very, very different. And I know it's because of the prep work that I did. So it's the labs is what gives like data isn't going to lie versus based on feel. So you're like, well, I feel pretty good. And it's like, well, what does that mean? You know, you can have a 6 hours of sleep and feel pretty good. And then all of a sudden you don't, So I just use data.
And can you talk to us about age? You're saying that a
Mhm.
lot of your clients come in and they're 35 plus, and that age part of the issue there is that we've just been alive longer and accumulating more toxins and exposed to different things. Is there anything else that we have to
Sure.
consider with age or anything?
Yep. Lots of things. I mean, you're heading into menopause. You're closer to menopause than you are to puberty. And I think most women don't realize when they start perimenopausal symptoms. So we have to look at our mothers. And if your mom went through menopause at 50, then you are going to have symptoms 15 years before that. You're going to start seeing hormonal changes. And so if your mom went through menopause at 55, you're going to see those hormonal changes start at 40 versus at 35. And if your mom had a hysterectomy or whatever, or like breast cancer or some other things that happened that threw her into early menopause, well, guess what? You still have to consider that because that's a metabolic issue, that's a hormonal issue, inflammatory issue. There's a disease process that was there. And so I do see women who are in their 20s who are menopausal. And so that's obviously a huge concern. But if you look at, so my mom, I believe she was around 55. I'm going to start experiencing symptoms around 40. The truth is, I can already feel it. I can already feel I remember my dad sent us a picture when we were like 12 years old. We were at the airport meeting my grandma, and I'm like, oh my God, look at my flesh. It's so vibrant looking. It's so young looking. Like it just is different. When you're 15, when you're 20, you have ubiquinol levels. You have your mitochondria is at a different level. You're not at peak at 15. At 20, 25, you are at peak for conception. And so most women now do not even experience that because they're on birth control. And so by the time they get off, they don't even know what it's like to have that level of those levels of hormones in their body, and the fluctuations and what that actually looks and feels like. So most women by 35 are starting to experience some hormonal shifts. By 40, definitely. And so whether it's very subtle where your skin doesn't feel as tight, it's a little bit drier, it's a little bit, maybe the hair is not, as vibrant. Maybe it's your menstrual cycle is becoming a bit shorter, or maybe it's a bit longer. Maybe it's just you started to get a bit more clotting. It's not like a 1 day shift, it's over the years, and so unless you're tracking it, you don't really know what's happening. Kind of like the scale. It's really easy to gain 10 pounds and still wear the same pair of pants. But if you're on the scale, right, you can see it. You're like, oh, I'm 2 pounds up this week. What's up? Oh, I'm up another 2 pounds this week. Versus like, oh, I think it's different. It has to be a big enough change where you go, oh, I don't fit into my pants. And it's like, well, that's usually a 10 to 20 pound, depending if it's yoga pants or not, So it's the same with these hormonal changes. They actually start way before we think menopause, right? We kind of think of those last 2 years where all the fluctuations, but the lead up has been going on for 10 years, and it's less favorable to have a baby. It's not impossible, but it's just less favorable. In my world, that means we have to work a little bit harder. We have to take the nutrients. We have to make sure the toxins are out. We have to make sure that the blood sugar is regulated because the body's not as good at doing it on its own. It just needs support, right? Because it's aging. And so we're trying essentially doing anti-aging stuff for both the male and the female. So I would say like that's kind of the biggest reason is that you are aging, and then the inflammation from the environmental toxins, all that is just adding to that. It's just speeding it up. That's all it's doing.
And with that information, people still are having babies later, and you
Yes,
can still have
you
really
can
healthy
still do it.
babies.
Absolutely. I just don't think it's a fluke anymore. Do you know, like it's a lot harder. And my sister, like she didn't meet her partner. Um, she was 37, I think, maybe 36. And so they started trying at 37. The conventional system literally was like, hey, if you don't get pregnant in 6 months, just come in and we'll do IVF. That's the prescription for anyone who's over the age of 35 going into a fertility clinic. And so fertility clinics are not fertility specialists, they're IVF specialists. That is what they are, or ART specialists, because you might choose to do an IUI or, a timed cycle before you go through IVF, depending on your case. But essentially, that's all they have for you. And so it was harder for her to conceive. And there was, of course, nutrient levels and deficiencies and all of that stuff, but she still had a baby. And then she realized that, like, you know what, I actually want to do this again, but maybe we can do some prep work ahead of time. And so we did, and I put both of them through my program, and we cleaned up their environment. And it's like the difference between the two babies, let alone the placenta when she gave birth, like it was crazy. She was just like, she couldn't believe it. And of course, she wished she would have done that for the first, but it's like, you just don't know what you don't know. I had the same experience with my firstborn where it was a total mess and I was super sick. And then labor just was not the thing that I thought it would be. It was not the experience that I thought it would be. And it was really hard for me to recover. And I wasn't sure if I was going to have more kids. But I also knew, I'm like, well, we used to have babies in the woods. And I'm pretty sure there's women who like love giving birth. So maybe I'm missing something as opposed to saying, like, I'm never doing this again. So the reason I share these stories is like, we need to learn from these stories. You don't need to just try and see what happens, especially if you're over the age of 35. Like if you're 35 and you're thinking about having a baby, I know you probably put some time into your career. I know you've probably put some time into securing and you're like in a good relationship and all that stuff. So it's like, why wouldn't you take this extra step to prepare yourself to have a baby? And it's like 3 months minimum, but ideally 6 months. This is what I say, go slow to go fast. Go slow, do the prep work, make sure there's no infections, make sure your partner is on board, optimize your nutrients. And then, hey, you're just going to avoid this whole dumpster fire that's happening for most people because they were told to try for 6 months and then they go and then they get medicated. And sometimes it works and a lot of the times it doesn't because the nutrients are still not there. The inflammation is still there. The blood sugar is still dysregulated. The infections are still there. And so it's, I walk my people through IVF, but we've done the prep work and we know what we're doing and why we're doing it. And it's very different outcome.
Yeah, I can see that. Yeah. So, can you tell us about your program? Is this something that you work individually with people, or is it
Yeah, I mean,
self-paced?
I have a couple different ways that I offer services. I have like a group program, and that's very much for somebody who's just, I don't want to say getting started, but they don't necessarily need a lot of help or work, or they're just curious about, okay, maybe I'll do some lab testing, maybe I won't, but here's some general things. Like I take people through a 10-week detox and, here's the nutrition pieces for fertility. And here's, if you find this out, this is how you do it and how you support drainage and detoxification and all that kind of stuff. And then the one-on-one, I have myself and I have a couple of practitioners that I work with as well that work under me. And we just support couples. It's like we do the initial consultation, we do the lab testing, and the program base is more like I don't get anyone to sign contracts. It's more of a month to month, but we build relationships and then we help you walk through whatever it is that the journey is ahead. I have people who just want to get pregnant naturally and they don't even want to bother going the conventional route. And then I have people who are like, we would love to get pregnant naturally, but we also want to have, and we're doing a lot more family planning and trying to figure out if it's IVF that they need to do it and when, and how do we optimize their chances, getting rid of infections, all the stuff that I just talked about. And so it's just really supporting the couple, whatever it is that they need. And the way that the analogy that I like to use, like, hey, we're going to hike up Mount Everest and I'm just going to walk with you every step of the way. And I know what the journey should look like and some changes that will come along the way, but I just need you to know step one, because I don't need you to know the turn that you're going to need to take 5 months from now. I just need you to know that like this is the leg that we need to make through now. And so I'll use the staircase analogy. What we're working on today is going to be very different than what we're working on a month from now, 2 months from now, 6 months from now. Because again, I'll see a lot of practitioners just like, and do this for 6 months or do this for 3 months. And it's like, what? No check in. Like there's so much that can change and will change and should change. And if it doesn't, then, you're missing something. But it's just being able to walk people through. And the more that I do it, the more I can predict, okay, this is the first, and then we can go over here um, and just supporting couples. Cause it's like, there's not a single journey that's the same. Everybody's different. Everyone's needs are different. Everyone's beliefs are different. Religion, like you name it. It's the end goal is to bring a healthy baby home and to support couples in doing that.
And do you get a lot of couples coming in, or is it mainly
I only see
women?
couples. I
Okay.
see couples only. Yeah. So my group program is mostly females. Sometimes the males will pop on, but I only work with couples. And that's just like, I I used to go back and forth on it. And one of my mentors is actually like, sometimes I'll bring the female on first and then I'll bring the male on. Uh, it's not how I want to do it. I don't think you can build generational health with just treating one person. And I think that a lot of the times the males now are a huge problem. And from a sperm analysis perspective, like 50% decline in sperm quality in the last 50 years. Like if that happens in another 15 years, we're at zero, folks. Like it's not good. And a lot of males do not go to the doctor. They go to the emergency room and they have so much stuff going on. They just don't know it because they've been told like, oh, carrying extra weight. It's whatever. And I'm like, your triglycerides level and your liver enzymes, like you're a walking heart attack, you know? And then they don't know that because it's just extra. Oh, it's just a little extra of this. But of course, that's impacting their sperm quality. Of course, it's impacting the way that they can show up for, their partner and support them and step into the protector and provider role and let the woman relax their nervous system as opposed to feel anxious about their men's health. So my rule is to just see both because like I said, I don't think you can build generational health with just treating half the problem.
Yeah, it's nice to see that we're talking more and more about the influence that the male has. Obviously, they're a huge part of it, but I think,
50%.
yeah,
50% of the DNA download is from the male. To be honest, I think males want to be involved. It's they don't want to be on the hamster wheel. And when they see their wives on the hamster wheel trying every single diet and all the supplements, and they're still not really getting better. And I speak this from just my own experience with my husband. He's a very logical man. I don't give him anything until I have labs to show him. Hey, you have this, we're going to do this for that. You have this, he's like, got it. I can do that. Right. And then you can see the progress and you feel better versus the vague, like you should just eat better or you should stop drinking or you should stop, and it's like, whatever. I don't care that I'm carrying a little extra weight. Yeah. It's not about the little extra weight. It's like, what does that represent? When you see someone like your blood sugar is crazy and you have fatty liver and like that's a heart attack in 5 years, they go, okay, how do I stop that? Okay, well, you're going to have to stop drinking. You're going to take these supplements. Do you know what I mean? So I think that men really do want to be involved. It's just we're approaching them in a way that a woman would be approached in healthcare, which is very different.
yeah. What resources would you recommend that people access if they want to start dipping their toe in this and learning more about it?
For sure. Well, I have a great podcast, Natural Fertility with Dr. Jane. So I share a lot on my podcast. I share my case studies, I share my thought process, anything that I learned. So when I work with mentors, modules I watch, when I do my presentations or a podcast or anything that I do, I share. So I find that that's a really great resource, genuinely. I think resource wise, if you go on and like Dr. Jane Levesque on Instagram, I think that there's a lot of fertility specialists and there's a lot of fertility information. I don't think that there's a lack of resources. There's a lack of being able to filter and know what's right because there's so much information and some of it is contradictive to one another. It's like, do this. No, do this instead. Keto is the best. Keto is the worst. Intermittent fasting is great. You shouldn't be doing intermittent fasting if you're trying to get pregnant. And so that's where the confusion and the kind of the hamster wheel feeling can kick in. My advice is to pick a couple and see what resonates. So like if you listen to my podcast and you're like, this is really valuable and I resonate, then like stick with that. But if you listen to it and you're like, meh, then go to your gut will guide you. If you're getting something out of and it's curious and it's piquing your curiosity and you're learning, you can follow that. And then, like I said, at some point, you have to decide when it's time to see a practitioner. And even then, when it's time to see a practitioner, you should be interviewing those practitioners. I see so many people are just like, well, I just found because they were closest to me and that was the easiest thing to do. But they don't actually like that practitioner. They don't feel heard by them, or they feel like something is missing, but they don't want to do anything about it because it, some of my patients, that I've been able to help that have had horrific diagnosis of like, you'll never have a baby or it's 5% chance. And not because it's like literally just because no testing has been done and they're like, sorry, you've been trying for so long. I don't think you're ever going to get pregnant. But that does really harm, the person. When they found me and I've interviewed them on the podcast, they're like, I just knew you could help us. And they've worked with other naturopaths before. And she had a feeling that she's like, this person doesn't know, but I'll just keep going. And it's like, don't do that. You're wasting your time, energy, and money when you're saying, like, well, I should be doing something. It's like put that time and energy and money into finding the person that will help, as opposed to listening to someone that doesn't really align or doesn't feel like they really understand you as a person, or like their approach doesn't align, whatever. Because I'm not saying my approach is not going to be for everyone. I have women who reach out and like, I don't want to get my partner involved. I'm not the right person for you. I just am not. I know this person, they'll treat you on their own, but I can't. That's like, and that's it. So just finding the person that will actually help, I think is important. And then listening to the content that actually resonates for you, that makes sense, as opposed to like, I don't know if that's right, you know?
Yeah, I think finding mentors and supports and guides in all aspects of our lives makes so much sense. And like you highlighted before, we do so much planning and we put so much work into finding a house or our career. Why would we not put that into
Having a
arguably the most
child.
important thing that we do? Yeah, having kids. So
It's for sure. It's the biggest commitment you'll ever make. It's the big, like, you can buy a new house, your house, right? Like it's, it's, I wish I knew this information before I started to have kids. Like you don't really understand what you're getting into. And then like once you're pregnant, they're like, good luck. you know? And then it's like, why didn't anybody say anything? Why didn't anybody, prepare? Like, why didn't I? And so the hope is to just educate, because even with general advice of like, start eating better, see if you can grow some of your own food, source locally as much as you can, get access to clean water, start moving your body more, get off the screens. It's like that will still be a tremendous impact. Even from my podcast, I have people send me messages and like, I got pregnant. And that's fantastic. So I think don't underestimate that advice. But if you feel really stuck, I just think you need help. I don't think it's because you're broken. I just think you need help.
yeah. Any final words of wisdom that you'd like to share? Any questions that I didn't ask that you wanted me to?
No, I think you did a very great job. I would just like, my belief is genuinely that pregnancy is a natural process. So if it's not happening, something is missing. And it doesn't mean that a natural pregnancy is going to be possible for you, but we do still want to work with the body. The body is incredible. I've seen some tremendous things. I've seen my mentors do some tremendous things. And I always want to be that hope, that beacon of hope for my patients and help them, because there's a lot of doubt and frustration. It's if this is something that you feel really called to, having a child, you feel the soul next to you, you can do it, but you feel like something is missing. It's not a journey that I would give up on. And I say that because, my mentor, who has been doing it for 30 years, fertility specialist, Dr. Leah Hitchman, she's like, when I ask her, I'm like, what's the biggest determining factor? She's like, if they want to have a baby, they'll have a baby. It's just not going to be what they think it is, but if they want to have a baby, I'll help them have a baby. And so if the contract is it has to be their egg and their sperm, well, then maybe there's, we'll have to, but I'm always going to present an option. And so to me as a practitioner, that was like, wow, okay, so if they want to have a baby, I'll help them have a baby. It just might look different than what I initially thought. And like I said, I would love for everybody to get pregnant naturally. And well, what if you're 43 and you want to have a baby? Do you know? It's like, well, maybe we can figure out a way to do that that's still really healthy, that's still in line with my vision and your vision, and to just like work with the patients to help you get them to their goal. So, like I said, it's not a journey that I would give up on, but I would just find that practitioner who is going to be that advocate for you, because I have lots of patients who are told you're crazy and you should go home and just give up on this and take this antidepressant because you're crazy. And it's like, I'd like to prove some people wrong.
Yeah. Well, thank you for being here and sharing your knowledge and all the work that you're doing for so many couples out there. It's incredible. It's inspiring.
Thank you so much for having me. It was great to connect.